Hello, World Clinicians. I'm here today with Dr. Ann Koch. Annie, thanks for joining me.
Absolutely. Hi, guys. It's Andy here. And I'm really excited to be here, Ali, because today, instead of talking about endodontic issues, where the gutta percha ends, how to stop the bleeding, stuff like that, let's talk about something that we all can share, and that is dental education.
Absolutely. Dental education is very important. Both of us are in the education world, teaching at different universities as well as also outside in terms of the CE and so on. But what do you think the dental education has, how has it changed over the years, and where is it right now vis-a-vis the new and the recent graduates?
And I'm talking here, just to be really specific about it, Ali, I'm talking about recent graduates up to about 5 years out of school. Mm-hmm. I have enormous empathy for you guys, and I say that for two reasons. First of all, I think the debt load that so many young dentists and medical students are acquiring is obscene.
Absolutely.
It's crazy. It's $500,000, $600,000 in debt. Secondly, the thing that really has my ire is the fact that so many dental graduates, as well as in a medical school, but let's concentrate in dentistry, are having probably the least amount of clinical experience during the 4-year dental school education. I'm coming across way too many of you who only did 1 or 2 clinical root canal cases in their 4 years in dental school.
Absolutely. And just to kind of put this in context, Annie has given more than 1,000 hands-on courses over the years. She's very active, still going out, giving presentations and talks. And so you have seen this, and you've been kind of focus grouping your classes.
1,000%.
And this is what's been your observation from the road here in the U.S., of course, and also in terms of the dead and song, because our videos are shown now and are viewed by many of the global audience in the U.S. This is that situation with the dental education is a big deal.
And there's 2 reasons for this, at least from my perspective. Number one is that the dental schools need the money, so they've kind of over-accepted the numbers of students. There's a lot of dental schools now. There's a lot of dental students, and again, it's the same thing on the medical side. But in addition to doing this, the postdoctoral programs, and let's talk specifically about endodontics because you and I know endodontics. The postdoctoral programs in Endo, Ali, have gotten to be ginormous. And there are so many endodontists, and for years, I used to go around the country saying as a joke, when did this complaint about that there's too many endodontists get created? That started when the second endodontist was created, okay? But now I really think there's a legitimate problem. And the other thing is that when you have these big, massive endodontic programs, the undergraduates get very little opportunity to do clinical endodontics.
That is true. I mean, if you look at it right now, first of all, we have about 66 dental schools here in the U.S. And with the number of graduates and the number of endodontic cases that are being annually, I think that translates in terms of the ratio of 80% root canals are done by general dentists and about 20% done by endodontists here in North America, or in the U.S. at least. That translates to for the last census on the total number of root canals, if they were all being done by endodontists, there would be like 5,000 cases per endodontist. Yeah. So it's important to kind of realize that the dental education should focus also on some general dentists being able to do efficient and quality endodontics.
There's so many things here that I could go on this topic for an hour, and I won't. I will spare everybody that. But there's a couple of things. First of all, one of the things that has happened is I think with the AAE, they need to emphasize more, not 3-dimensional irrigation systems, not some kind of 3-dimensional microscopic things. What they need to focus on is on undergraduate dental education. Because what I'm seeing is not only, Ali, am I seeing a lack of clinical experience for many young dental students, they don't even know all the benefits that well-done endodontics can provide their patients. And I think that's a big thing. It's also incumbent upon endodontics to teach these students the merits of endodontics, to incorporate endodontics as part of the overall treatment plan.
Yeah, absolutely. I mean, it's for the sake of the patients themselves. There are, unfortunately, what happens in terms of the numbers, we always have not a very equal distribution of specialists to general dentists. So there are areas where there's great need for specialty work, and then there's areas where there's a lot of saturation. But graduates or dental school graduates are going to end up in places where they don't have access to endodontists. They should be able to do adequate cases.
And let me tell you a story. And this probably had to do also with you when you were a resident, and like, wait, who was your director? Oh, that's right, that was me. Okay, excuse me. Anyway, I had a rule, and this was really interesting. I don't know if you remember this, but before any of the endodontic residents could take a case from an undergraduate dental student, the rule that I put into effect was you had to find a replacement case for the undergraduate student. And when I mentioned that, everybody started chirping like it was like The Simpsons. And to me, there was no discussion on it, if you remember. And the reason to me, and my residents were like so surprised, like Dr. Koch, there's like no discussion. There's none, zero. And for me, it was so simple. And they said, what's that? And here was my response. They also pay tuition.
Right.
And the fact is, for an endodontic resident to find a replacement case for an undergraduate dental student takes, oh yeah, that's right, about 20 minutes in the emergency clinic. So, and I also like this idea about creating this relationship between general practitioners and endodontists. This is a dynamic relationship that you know very well here practicing in Boston.
Yeah, I mean, the teamwork approach to patient care has always been around, hasn't been emphasized as much as it should have in the past. And it's important for us to go back to it again, where the specialists treat cases in which they're the most effective.
Absolutely.
And work with their referring dentists and their general dentists to do cases that they're effective at accomplishing, with the main purpose of focusing on what's best for the patient, obviously.
Absolutely. And Real World Endo has always been about doing cases that you feel comfortable doing, not getting into places and spaces that are like over your head, because that not only does that become very stressful, it's not profitable. The other thing that's going on in dental schools, and this kind of goes against the fact that everybody says everything and parrots the opinions. I'm all for new technology, latest material science, and we've done that at Real World Endo through the years with different products and techniques. But what happens is you can't worship at the altar of technology. You have to take the latest technology and combine it with long-established evidence-based principles. Go forward together in concert. What I'm seeing at too many dental schools, they're using technology as a crutch.
Yeah. Yeah.
And guess what? The sim doesn't grab the handpiece. The sim doesn't have problems getting numb. The sim doesn't have problems with bleeding stopping a hemostasis. So this is all the stuff that I'm very wise to. I'm totally animated and committed about having these young dentists get to hands-on courses, really learn how to get trained up in the field of doing endodontics.
You're absolutely right. I mean, we can't have technology for the sake of technology.
Right.
And you've always been a big advocate of the idea of, simplicity and making sure that we keep things simple, not just complicating for the sake of complication or change, but rather make sure that every change that we cause is in fact incrementally towards making things either better, faster, or cheaper, which is the same three principles that everybody
everybody
would like
parents,
to
exactly.
parents. So I agree, but how do we find that right balance?
I think one of the right balances here is this other thing here too. Again, one of the things in dental school curriculums is that too many dental schools don't have a business aspect to the curriculum. You have to have people come in who've lived it, people running practices, somebody from the business school. Most dental schools are part of a university that have good business schools. How to live with debt, how to manage things, okay? Because what I'm seeing also, I'm seeing young dentists come out, and this perturbs me, and I have enormous empathy, who feel they kind of got shortchanged, like I sold the bill of goods. Now they've got $500,000 in debt. I really don't know how to do a clinical root canal. Oh my God, does my life suck? I don't like that. Dentistry is a wonderful profession. It's been good to you, it's been good to me. And I want these young dentists to be able to go out, train up their skills through hands-on courses that are really good, start to be able to incorporate these procedures into their practice. Too often now, Ollie, I'm seeing young dentists who are forced in their working situations to be doing cavity preps on incipient lesions. You know and I know if you have an incipient lesion, 5,000 parts per million fluoride toothpaste, you can arrest that lesion. But I totally empathize with these young dentists who have this production thing that you got to do this, you got to do that. I want dentists to do well financially, but especially that first year out, I want them to do quality patient-based dentistry if at all possible.
I I mean, that leads to the whole other conversation, which we kind of had discussed. We should maybe make a video about at some point down the line about the role of corporate dentistry. Where is dentistry going?
Right.
What is going on a
Exactly.
macro level in
Totally.
this field, which we both love and
Right.
we've dedicated a lifetime to. Where do you think a private practice today should be positioning themselves in terms of if it's an independent private practice or some of these new graduates? What do you see? What is the dynamic?
We're going to come back.
We're
We're going to let these people digest what we're talking about
Yeah.
here. And we're going to come back and we're going to talk about, does the modern dental practice need to change? Does it need to expand its scope? But before we go there, what I want you, and so does Ollie, both of us want you to send us your comments, send us your thoughts. How can we help you guys do this transition from student to practitioner? How can we help make this more successful for you? So please, I know sometimes it's a bit of an effort responding on comments, but send us back your thoughts in terms of the debt load, in terms of your clinical experience in school. How can we affect change in that area?
Absolutely. So comment below this video. We're going to cut this one short and come back and do the other
Yes.
another little segment on the private practice side. But comment below and share with us your experience in terms of where you are in your career. We want specifically and especially hear more about the recent graduates and where can we be helpful
Absolutely.
to you.
Totally
Perfect.
committed to that.
Awesome. So I need to just take a quick break and come back and do the next video.
See you soon.